What unique drainage issues cause different types of glaucoma? Imagine your eye as a tiny, busy water park. The water inside, called aqueous humor, needs to flow out smoothly to keep the pressure just right. When this flow gets blocked or slowed down, trouble begins. That's what causes different types of glaucoma, each with its own drainage problem. In open-angle glaucoma, the drainage system looks normal when you look into the eye, but it's not working efficiently. The trabecular meshwork, which acts like a filter at the drainage angle, becomes clogged or less responsive over time. This causes the fluid to build up slowly, raising the pressure inside the eye. Because the angle remains open, the problem develops gradually, often without early symptoms. This is why it's the most common form of glaucoma and can silently damage the optic nerve over years. Sometimes, even if the pressure isn't high, the nerve can still be harmed, which is called normal tension glaucoma. In this case, poor blood flow might be the culprit rather than drainage issues. Now, angle closure glaucoma is a different story. Here, the drainage angle between the iris and cornea becomes physically narrow or even completely closed. Think of the iris as a curtain that can bow forward and block the drainage pathway. When this happens suddenly, it causes a rapid spike in pressure. This is an emergency because the high pressure can quickly damage the optic nerve if not treated right away. People with smaller front chambers in their eyes, often those who are farsighted, are more prone to this type. Sometimes the narrowing happens gradually, leading to a less obvious, chronic form of angle closure glaucoma. Congenital glaucoma is present from birth. It happens because the drainage structures in the eye didn't develop properly. Instead of forming a clear pathway for fluid to exit, the drainage angle is malformed or incomplete. Babies with this condition often have enlarged eyes, sensitivity to light, and watery eyes. It's important to catch this early to prevent long-term damage. Secondary glaucoma occurs when other problems or injuries interfere with the drainage system. Inflammation, trauma, or deposits can damage or block the trabecular meshwork or the angle structures. The drainage issue here is caused by an underlying condition, but it still results in impaired fluid outflow and increased eye pressure. In summary, the drainage issues in glaucoma are all about how the aqueous humor exits the eye. Whether it's a clogged but open drainage pathway, a physically narrowed or closed angle, developmental abnormalities, or damage from other conditions, each problem leads to different forms of glaucoma. Recognizing these differences helps eye doctors decide the best way to lower pressure and protect your vision. Regular eye exams are key because many forms of glaucoma don't show symptoms until significant damage has occurred. Always consult a healthcare professional for personalized advice and treatment options.